Before diving into the philosophical problem at hand, we'd like to give you some background information about our country of origin, Scotland. Scotland's population is made up of 5.4 million people, making it the most sparsely populated country in the UK. Scotland is also known for its legends and myths, for example, the Loch Ness Monster, which is only fitting that the country's national animal is the unicorn. Scotland is also made up of 790 different types of islands, which are separated into 4 groups or territories. You got the Shetlands and the Orkney. You also have the Inner and Outer Hebrides. Although it's a stereotype for those of Scottish descent to be redheads, it has actually been discovered that Scotland has the highest amount per capita of redheads. Now that we have told you a little bit about the country of Scotland, we will dive into the first major problems, theft. Now, I think it'd be appropriate to start off by defining what theft is. Theft is defined as the taking or appropriating the property of another without the true owner's consent and with the intent to deprive the owner of the property. Although this definition may look pretty direct, there are actually a lot of gray areas when it comes to actually defining, and there's room left for someone's own personal interpretation. However, one thing is certain, and that is the punishment. There are a couple different ways. The first one is a fine of £200, which is the equivalent to $275 US, or you can be jailed for up to 6 months of time. Thefts such as burglary, however, are a much more serious offense and also comes with a much heavier punishment than the ones listed previously. Just to show you how much of a problem theft truly is in the country of Scotland, we have provided a chart below listing the amount committed from the year 2002 to the year 2020. Just last year, it was approximated that 111.41 thousand thefts have been committed in the country of Scotland. This is the lowest number the country has seen since the year 2002. However, compared to the decade before, there have been about 113.38 thousand less deaths being committed in the country, which is a good sign for the coming years. Although there hasn't been much data collected recently due to the outbreak of the coronavirus, it has been stated that theft has become much easier in the country due to the mandatory face mask rule, meaning that we could see another spike in thefts. Even though thefts in Scotland have steadily been on the decline, the year 2017 and the year 2018 showed us that it is still a looming problem in the country, as it spiked as much as 9%. These numbers help to put into perspective how many people are stealing, but it doesn't discuss the issue of why. In most people's cases, theft is committed because they cannot afford to pay for things like food or clothes. This is backed by the fact that Scotland's poverty rate is very high, with about 1 out of every 5 people are living in poverty. The welfare reform in the United Kingdom is partially to blame for this problem. From a psychological perspective, the issue of theft in Scotland can be attributed to a psychological compulsional note of kleptomania. Kleptomania can be defined as a recurrent urge to steal, typical without regard for need or profit. Kleptomania can be caused by things such as pre-existing mental illnesses such as BPD, anxiety, substance abuse, depression, personality disorder, and OCD, which it is closely linked to. However, these are not always the only cause of kleptomania, as it can also sometimes be caused by internal issues such as jealousy and lack of confidence. Some external issues that can cause cases of kleptomania and others include things such as peer pressure and the feeling of being excluded. Clinical psychologist Dr. Jillian Moore-Growerk believes that even bulimia can be associated with causing theft, stating that, to a large extent, it is an attention-seeking act or a cry for help. In the last 20 years, I would have treated many bulimic cases who will often shoplift food-related items during periods of binging. She also goes on to say that the first thing I usually tell people is that it is often a symptom of something going on elsewhere in a person's life. It may also be that in our increasingly materialistic society, there is a pressure there to have certain items. Personality characteristics like unfriendliness or unreliability can play a factor in people and thieving. Before we move on, we'd like to show you a little video explaining what kleptomania is, just a little bit further than what we've already included in the slide. So please sit back and enjoy the video.
You may not realize it, but there are many people out there with kleptomania living secret lives of shame, afraid to seek mental health treatment.
Yeah, doctors actually call this a rare but serious mental health disorder. For more, we're going to go to Sunrise reporter Roland Rodriguez, who joins us now live from Bayview Behavioral Hospital. Good morning, Roland.
Good morning, guys, and good morning, South Texas. I guess it all comes down to asking the question why, or why is someone, understanding this is the hard part, I guess. Someone becoming a kleptomaniac. So now joining us is Dr. John Lucen, who may know a little bit about this subject. How you doing, Doc?
Good morning. How are you doing?
For those who don't know, what exactly is a kleptomaniac?
Kleptomania is the inability to stop oneself from stealing.
Yeah. This is something that people just don't understand. Is this a crime or is this a disease?
Well, that's what we have to come to a consensus about as a trained professional looking at these people's behaviors. Is it something they control, or are they doing it more for the thrill or perhaps the use of it, whatever they're stealing?
So what are some of the signs that we should look for?
Well, it's on more of a spectrum of impulse control disorders like an OCD. So just like somebody is going and stealing an item, is something of significance? Can they stop themselves? Do they feel regret afterwards? What are they doing with the option after? How much do they steal in general? So a lot of factors come into the diagnosis.
Who's at risk of, developing this disease?
When we look at the statistics, early on children, they go through phases where they, might be stealing things and other. If they continue with that, we'll see that as adults, women more often than men are stealing.
Is this something that we know it's not curable, but can we treat it?
Yes, a combination of medication, behavioral therapy. A lot of times we see dysfunction in serotonin receptors, in dopamine receptors, and so both combination of medications and therapy is what we've seen as the most effective treatment.
When should we seek help? I mean, obviously, the sooner the better. But is there a time that we realize that I need some help because I don't know what I'm doing?
Absolutely. If people are finding themselves in legally sensitive situations, or else they find this as a behavior that's escalating, as the holiday season's approaching and they have to go into more stores, definitely come and get it checked out. But before, they might find themselves behind bars.
Yeah. So the key is just trying to help those understand what they're going through.
Absolutely. We do free behavioral assessments over at Bayview Hospital anytime. So if somebody finds himself in this situation, they should come over and get it checked out.
All right. Doctor, thank you so much for your time. Really appreciate it. Of course, you would like more information on this subject. All you have to do is visit our website at kristv.com. Reporting live from the Bayview Behavioral Hospital, Roland Rodriguez, Chris 6 News.
Now that we have given you Scotland's biggest problem at hand, and some statistics to show just how bad it is, we've offered up some psychological solutions to help combat the problem of thieving. Kleptomania is treated with medication like naltrexone, commonly used to combat addiction, and antidepressants such as fluoxetine. Therapy is also a commonly used tactic in order to help those who suffer from kleptomania. Medication can also be used to help combat things such as depression and OCD, two disorders that can also be commonly linked to people who commit theft. External issues such as peer pressure can be combated by client-centered therapy. Solving this problem from a psychological standpoint is only half the battle. However, as we explained before, a major reason people steal in Scotland is due to its high poverty rates, with 1 out of every 5 people living in poverty. This means that not only is a psychological issue, but it is also an economic issue. This means that the government will have to try and handle this situation directly, as if they can decrease the poverty rate, it will affect the theft rates as the poverty rates decreases. This can be achieved by giving those in need easy access to food banks, clothing, and housing. Another solution the government could use is to increase the national minimum wage and living rates, as the minimum wage is £8 or roughly $11 and the living wage is £9 or $12.
In conclusion, stealing in Scotland can have major consequences depending on the severity of the crime and prior charges a perpetrator may have on the record. Stealing rates have decreased from 2002 to 2020 overall, but in the year 2018, it increased by 9%. Stealing can be brought on by a couple of factors, the most common one being poverty. Psychological factors such as mental illnesses, for example, OCD, depression, anxiety, and kleptomania, and in some cases, eating disorders such as bulimia. Social pressure, such as jealousy and lack of self-confidence, are also a contributing factor. There are psychological and economic solutions regarding stealing in Scotland, psychological being medication and therapy, economic being increasing living and minimum wage, easier access to food banks, clothes and shelter, and more.